Hello and welcome to our live broadcast sharing Providence's annual report and community health initiatives. I'm Justin Crowe, Senior Vice President for Community Partnerships at Providence. As a reminder, the information provided in this event is for info purposes only. If you have any medical questions, please reach out to your primary care or your healthcare professional. Let's begin. So joining me today in this live event is Megan McInich-Jones, our Executive Director for Community Investment Strategy and Evaluation, and Beth Shank, our Executive Director of Environmental Stewardship. Welcome.
Thank you.
Thank you, Justin. Nice to be here.
So we're pleased to share our annual report showcasing our commitment to the health of our communities. And this report really highlights how we give back and how we invest upstream in health for our communities. So why don't we start with some questions. Megan and Beth, please tell us a little bit about yourselves and your roles that you serve in at Providence. Megan, let's start with you.
My pleasure. Thank you. I have the privilege of leading our community investment strategy and evaluation, which includes the community health needs assessment and our community health improvement planning process. So our team provides the data and technical support around community engagement, as well as some robust resource mapping that supports each of our regions as they go through this process. And in addition to that, we're really accountable for implementing a cohesive strategy for how we address those most frequently prioritized health needs and how we show up in our communities to meet those needs and how our work shows up and shows an impact in our community. Sorry, got speaking too fast there.
Thank you. Beth, how about you?
Well, I am so pleased to be here, and I'm also so pleased to be the Executive Director of Environmental Stewardship for Providence. I'm a nurse, and I've been with Providence for over 30 years. And over that time, I have seen care from the bedside, yes, but also I've seen how committed Providence is to every patient and family we serve, and also how deeply involved we are in the communities we serve through community benefit, philanthropy, advocacy, education, and more. And the annual report that we're sharing today covers a lot of that. For environmental stewardship, this is also an important commitment for the communities we serve and also our greater community, the planet, as we do our part to care for our common home, which is necessary for us to meet our vision of health for a better world. So I'm pleased to be here. Thank you.
Great. Thank you both. So I think it goes without saying that 2020 was a really challenging year. And it really required a quick and an agile response to our community and to our patient needs. So I'm interested in your perspective on how the annual report reflects Providence's adaptive and agile response in 2020. Megan, let's start with you.
Sure. I think probably most important to me is that this annual report really shows how Providence stayed true to our mission in supporting and engaging with our communities throughout the midst of the pandemic, really through investing and prioritizing the health and well-being of the communities we serve. In this annual report, we get to highlight stories from each region of how we're meeting those specific community needs and how we come alongside different partners to move forward across our key initiatives. In 2020, we contributed nearly just over $1.7 billion in community benefit across the communities we serve, including $362 million in grants, programs we knowingly operate at a loss to meet direct needs through subsidized health services, and other proactive spending that ultimately complements our patient-focused community benefits, such as charity care. One notable change that we had in 2020 as well was the transition away from sponsoring specific events such as fundraisers or galas, and really redirecting those resources during the pandemic to directly support our community partners in program delivery and specific outreach efforts.
Well, that's great, Megan. Thank you. I think that last pivot was really important because our community nonprofit partners really faced an existential crisis in the early part of 2020, and I think we were there to be a partner and to support them. Beth, be interested in your perspective.
Well, 2020 was a year like no other. As we think back to what has happened in these past 18 months almost, and Providence really served as it usually does, by responding to the needs of the day, responding to the needs in our communities and in our globe. So some of the work that Providence Advocacy did particularly was really demonstrating what you said before, Justin, agility with addressing the needs that COVID brought to us, from working on more Medicaid expansion in our states to helping practitioners, different clinicians practice across state lines. We were really needing to move around our resources. And as is often the case, we partnered broadly across all of our regions, 7 regions across the West, plus our physician partners, nursing, pharmacists, other clinicians, and the communities we serve, in order to make sure that we were addressing relevant needs for what people were struggling with to get through the pandemic and to have the ups and downs that we saw across that year. It was just amazing. Now, in my own work, I also see this same response to the needs of the day, which is, one of the things the sisters left with us, is that they wanted us to be able to respond to the needs of the times. So one of those also that came out in 2020, kind of amazing, is our very bold commitment about our carbon footprint. So in April of last year, we announced our goal to become carbon negative by 2030. This is the boldest commitment in U.S. healthcare. And that we did during the pandemic, because that too is an issue in our communities and in our globe. So we described successes and improvements from across our system in different regions, from solar panels to wind power to gardens, recycling, chemicals reduction. All of these are necessary pieces in cleaning up our world. And this is important in the end because, and in the beginning too, because pollution does not affect us all equally. More vulnerable populations are more exposed. They have less cushion to recover from events like wildfires or bad air pollution days. Further, they're more likely to live in fence-line communities that are closer to major freeways, incinerators, or heavy industry, which puts the health of those communities at risk. To help address some of this, Providence has developed an environmental justice collaborative, so we can ensure that we are seeing these issues and assessing them and taking them into account when we make those investments that Megan talked about with community benefit and other ways that we invest in our communities to help them develop and thrive in healthy and equitable ways. So it was a big year.
Well, thank you, Beth. I'm really glad you raised that issue, because I think a lot of folks don't realize the disproportionate impact that environmental degradation has on, particularly the economically poor, the vulnerable, and our communities of color. And so it really is a social justice issue, and it's linked to kind of our broader focus on social justice as an organization. So, kind of jumping on that, Providence has really tried to serve under-resourced populations and to advance health equity and social justice in our communities. And we really have done that in 4 different areas. So I want to kind of highlight those areas, and then I'd love to get some examples from each of you from the annual report. So the first is foundations of health. We know that to ensure our community's most basic needs, such as food and shelter and education, that's really foundational, that you can't have health without that. Similarly, we really looked at reducing the barriers to care so that we can provide equitable access to compassionate care regardless of where you live and who you are. The third thing is really around community resilience and building capacity at the local level to keep our communities strong and stable. And then finally, really innovating for the future. How do we pursue innovation to really help people live their healthiest lives? So those were the 4 kind of themes for our annual report and the 4 areas we focus. I'd love to hear some examples from each of you on those. So Megan, let's start with you again.
Sure. There are just so many wonderful examples of this work. A few that really come to mind for me around that theme of removing barriers to care. Access to care is consistently identified as a need through our various community health needs assessments, particularly for communities that are underrepresented in the public data and otherwise. And so some of the examples of our work in this space include community navigation services, a great program we have in place in Texas, supporting our low income and uninsured community members to ensure that they have adequate access to primary care and to help address their basic social determinants. Justin, as you noted, another huge area of our focus with foundations of health and otherwise is really addressing those social determinant needs and social risk factors at the population level. So where and how we are coming alongside with our communities to address the crises in affordable housing, access to shelter, and making sure that particularly school-age children and seniors who might be experiencing social isolation are supported both through visitation as well as through food security support initiatives. So we really kind of span the gamut in how we address these needs. That varies region to region and market to market based on who those partners are and the specific opportunities. And our advocacy team is just a great partner in making sure that we're making all of this come together. The only other thing I'd highlight too from the lens of community resilience is the excellent work of our St. Joseph Community Partnership Fund. They really pivoted to be able to provide funding and direct support to our communities that had experienced wildfires. And so that disaster relief and opportunity to really support our caregivers and our communities in that time in the midst of so much else that was already happening is really a highlight for me in how we come together from that space.
Yeah, thank you, Megan. 2020, so many different things happen. It's easy to just focus on COVID, and yet there were the wildfires and many other challenges as well. So thank you for highlighting that. Megan, I'd be interested, or Beth, I'd be interested in your take on some example stories or some examples from this.
Yeah, well, again, there's so much, but just echoing a little bit of what Megan said and tying the food insecurity work. This is a great example of how that links to a sustainable future in terms of our climate change and also waste. So one of the things that we advocated for in 2020 was really supporting the California Edible Food Recovery Regulation that requires 20% of discarded edible food to be recovered and donated to someone who can actually get nourishment from it. So we're taking that beyond California and spreading that throughout our entire health system. So that's an exciting step forward. Also, we had worked on food scarcity at Southern California and the Children's Lunchbox program in Anchorage, Alaska. So these are all ways that we provide nourishment and also reduce waste. So I love these win-win circumstances that tie the immediate health of people's needs to our long-term health in caring for the communities and the planet. Another area to bring up is, again, talking about environmental stewardship, which is where I spend most of my time. We launched the We Act framework, and this is highlighted in the report, and it's something that we talk about quite a bit. So We Act stands for waste, energy, water, agriculture, food, chemicals, and transportation. And by using that as both a framework and a communication piece and a way to measure the actual impacts of carbon pollution, this has gone far and wide already in just 1 year. And as mentioned, that's highlighted in the report. And then I wanted to just talk a moment about community resilience, again, in responding to natural disasters. So you talked about fires, Justin, and we've already heard that this year it's kind of looking dry in the West. And all of us who live, really west of like the Dakotas probably are starting to get used to the smell of wildfire smoke in the summer. And so this is an important issue for our community health circumstances. People who might have asthma or might have any sort of lung disease are made sicker by this. And so this is a way that I can already tell our attention is shifting as all of our ministries are really along the West Coast and from Alaska all the way to Texas were impacted by this. So our work toward finding homes after the Oregon wildfires was really important, and our disaster response and preparedness initiative that really helps through the St. Joseph Community Partnership Fund when people are struggling after, an unforeseen event or an event that happens so fast you really can't deal with it. So these are continued ways that Providence stays relevant and timely and is serving the need where it hits the hardest. And I'm so proud to be a part of that. Thank you.
Well, thank you, Beth. I think both of you did a great job of highlighting really the diversity of work that we do, everything from community programs to kind of environmental work. Another thing that kind of jumps to mind for me is the work that we did in the advocacy space. So not only were we involved in advocating for Medicaid expansion and things like that, but we were also involved at the local level in ensuring that that there was a moratorium on evictions, particularly for kind of the economically poor. And so I think that's a really important component that Providence comes alongside our communities in a lot of different ways. So Megan, maybe if we go to the next question, I'd love to hear how a little bit about Providence's community health needs assessment and really how you use data to help guide the decisions in how we invest. And I'd love to hear an example that kind of demonstrates how that comes to fruition.
Yeah, absolutely. This is really the sweet spot and where I get so excited to talk about this work. And, Beth and Justin have both mentioned the fact that, the sisters call us to respond to the signs of the time. And one way that we get to do that is really through our triennial community health needs assessments and staying true to that heritage of going into our communities, understanding their needs, and then developing plans for how we respond to those needs. And say, all nonprofit hospitals, most hospitals in the US conduct a community health needs assessment. But one unique feature that we include with ours is actually a mapping and visualization tool in ArcGIS, which really helps us to look at our data within its geography. And this helps us understand where the greatest needs are based on that data, and then really how we can best locate or develop specific partnerships to ensure that the access is there for those who need it most. In our listening sessions and our key stakeholder interviews, we really strive to hear from those with lived experience of the needs we're trying to meet, so that we aren't trying to solve problems from within our own mental constructs, but really engaging the community in conversation around what's already working and where we can build upon to address those needs. So a few specific examples that come to mind. One, a few years ago with our team in Oregon, using clinic level and community level data, we were able to identify a few key communities where we could actually co-locate a high-performing social service agency in the clinic or hospital lobby. And that really reduced the barrier for our providers and care teams to asking patients about their needs related to social determinants such as food security, housing stability, and utility assistance, because they knew there was a resource right there to be able to support those patients and community members. That program has now been up for the last 5 years. It has actually expanded across the state to several other markets with different community partners, depending on the needs that need to be met based on that community. But we've really just seen it be a great resource that's focused first and foremost on identifying where we can best address those needs and what kind of resourcing we need to bring in from the provider side, from the community action agency, or otherwise to meet those needs.
Great, thank you.
Oh yeah.
So that's a really great example. I really appreciate that. So I want to actually take us to the next section because I want to talk a little bit about stories. And one of the things our chief medical officer always says is no data without stories and no stories without data. And so it's really easy to hear a large number like Providence gave out $1.7 billion in community benefit, which is just astounding. But when you hear a story that resonates in your heart, I think it impacts you in a different way. So I'd love to hear an example of a story that resonated with you from our annual report. So Beth, let's start with you on this question.
Well, I'm thinking of a couple of things that happened in 2020. Some of them were ongoing, but were beefed up really because of the pandemic. And one was the response of several of our hospitals, again, about food, but about employees creating gardens and volunteering dozens or hundreds of hours to grow food that's given to people who need it. So it's not for staff and it's not wasted. It's actually given to, in Montana, there's a wonderful garden that is donated to the food bank, the local food bank. In Oregon, there's a wonderful garden that's donated to, they live in a rather low income, the hospital is situated in a rather low income neighborhood. So it's for those neighbors directly. So I love those stories. The garden in Montana also has a prescription produce program. So that means people who have an issue with diabetes or prediabetes or any health issue that really it's recommended that they eat more fresh, organic, high quality produce, they can get that for free from the garden. And that's just a way we put our money where our mouth is, basically. And the people who work in the gardens are happy to do it. They thrive with it. The people who are able to get the food, they too are happy with that. Just another quick story that happened in Alaska that was really interesting is in the early days of the pandemic this year, the pediatric unit family members were required masks before masks were really all that prevalent or accepted. And so the staff just jumped on that, and they sewed masks out of, sometimes it was linen that was going to be discarded from the hospital. Sometimes it was linen, a fabric that they had at home that they sewed into these fun masks for the parents of these pediatric patients to use. And it's heartwarming. And also, when it's so frustrating when you're in the middle of a pandemic or in the middle of a fire season and you feel like you're powerless, it's helpful for our caregivers to be able to give back to the communities in these ways.
Well, that's such a great story, Beth. And we've become so accustomed to masks today that it's hard to remember a time when that wasn't kind of the standard. And so what a compassionate way to address that. Megan, I'd love to hear some stories that really resonated with you as well.
There are just, as Beth mentioned, so many excellent stories, both those that are in the annual report and then so many others that we have the opportunity to hear from our own caregivers in community health and others as they do these outreach efforts. One that just holds a really special place in my heart, of course, is our work with Work to Be Well, and really engaging with school-age students around mental health and promoting mental health. And what has been remarkable for me, as not a direct person engaged in the program, but kind of just seeing it around the periphery, has really been listening to these students find their voice, and to have the opportunity to witness their presentations and their growth in their self-advocacy, and just how strong of role models these students have really come to be, even for me, and learning through them. And so there are just so many students that are deeply involved there, that I just absolutely have to highlight the Work to Be Well program. And I think some other, a couple other pieces that really stand out are all of the work of our community health workers and our promotorious programs, particularly in addressing testing and vaccine outreach for coronavirus. In many of our communities, these are individuals who are trained, lay people who are trained as community health workers. They provide screening services, potentially in normal times, or community health education, and really meeting each of our community members where they're at, often speaking in Spanish, that it's comfortable. They're a trusted community member. We have examples of this across Southern California, in Walla Walla, in Oregon, all across our footprint of just folks really engaging with their communities in service. And to me, I just find that so inspiring and a great way that we are showing up to promote and support equity in all that we do.
That's great, Megan. What resonated with me in what you just highlighted is that you were learning from the students, and it reminds me of something our high school head of school says, which is that his role is to be the chief learner. And I think there's an element of that when we can learn from our youth today, and they have a voice and a perspective that we don't necessarily have because they're looking at it in a new way. So I think that's great. I want to highlight one story that really resonates with me as well, and this is with the CARE Network in Northern California. And for those that don't know it, the CARE Network, it stands for Care Management and Advocacy, Resource and Referral and Education. And it's really a network that brings together nurses, social workers, nurse practitioners, and community organizations to honor the dignity of every individual and to really treat them holistically. So there's a great story in the annual report that highlights an individual who came in and had multiple health challenges, and also had some housing insecurity issues and a lot of family challenges. And so we were able to really support that person and find housing for him. We were able to provide care management for his medications, and we were able to bring kind of the right set of healthcare practitioners to meet his needs and to ensure that he could live a healthy life and be as successful as he could be. And it's just such a great story of, we're not just a healthcare company that provides healthcare to people when they come into our hospitals. We see the dignity of every individual and we are going to do everything we can, including on the social front, to support them. And I think that's a theme that runs all the way through the annual report. And I don't know about you, but you hear that, and it just makes you proud to be a part of Providence and to have the opportunity to have that purpose. It's not just a job; it's really kind of living out our mission in our communities.
And you know what's really cool about that, Justin, is it happens in over 50 communities where Providence is. It's just how we are after, I think, so much work on mission and our alignment with the sisters' wishes and our commitment to justice. And I enjoy seeing that in communities that I've never been to, just hearing these stories. And I agree with you. It makes me proud to be part of it too.
Yeah, that's a great call out, Beth. I mean, I think we live in a country that's very divided right now, and yet we serve across 7 different states, and those states are liberal, they're conservative, they're different communities, they have different needs. And I think we're an organization that meets the needs of each of those communities, irrespective of where they come from. So why don't the last question, Beth, for you would be, we've probably got a lot of listeners hearing this and they're wondering, like, how can I get involved? How can I support Providence in these community health initiatives? How would you respond to them?
Well, I think, first of all, to pay attention to the Providence services in your area, because there's always something happening, from education to community events to volunteer opportunities. Usually there's good food if you go to the cafeteria. Also, please check out this annual report. This is just fresh off the presses today, and it's got a lot of super interesting information, and it takes you to different links that you can learn more about Providence and about this work and about the needs in our communities, which are always good to understand. We also invite anyone to help support Providence. And that could be through donation or through volunteerism. And if you're interested in donating money, you just go to providence.org/donate. So there are many ways to get involved. And probably if you live in a community with a Providence facility, you know people who work there. So you can ask them about Providence and what's going on and how they're engaged in the community. So please welcome to the Providence work in the world. Great.
Thank you so much, Beth. I just want to thank both of you for joining us today, and I want to thank everyone who's listening and sending in questions. To learn more about our initiatives, as Beth highlighted, our programs and services, please visit us at providence.org. And thank you again. I hope you have a wonderful day.